Citizens' Voice and Action is a local level advocacy model that we use to engage decision makers, duty bearers, to improve services for communities at local level. So with this model, community members are trained on what the standards should look like in terms of services, for example, in healthcare facilities, in schools, and all those services that improve the well-being of people. Once they understand what the standards should look like, they use this model to engage decision makers when they see gaps, so that these services can actually improve.
We have trained community members, the CVA groups, in advocacy. So the communities are able now to stand on their own and engage the stakeholders, to engage the service providers for the gaps they have identified.
Ilo twasambirire pali CVA, Citizen Voice and Action, bwakwe ati tutwalanshanya kupitira mukulanshanya twasangamo so twingabomba ekisuma ekyakutwala ubuyantanshi mchalo chesu nangu mu community umo twaikala okupitira muri ine CVA committee naileta ama changes ya yengi more especially pa facility yesu ine ya pa health post akubula information ya isana ba world division mu CVA na ya ma structures yo tukwete aya pia pali health facility ngata tukwete pantu ngata twaishiba pa kwambira nefya kuchita opo CVA ishira muri uno mushi ba committee aba members abasango muri akakabunga CVA ekubika pfena ini na afileta ubwafurisho ubukankala sana pa maskulu abantu nabeshi befe skulu lingiro kuba niba teacher banga balingiro kusangwa hapo pachipatala abantu nabeshiba fish feeling kusangwa pachipatala.
So that group has been advocating for this community to bring up more infrastructure at this facility. Those infrastructures that will help us in saving this community and improving in the service delivery of this facility.
The community, the CVA group, engaged the road constructors and they have provided the COVID center and 2 staff houses. And this is through the works of CVA, engagement and dialogue with the stakeholders.
The recent completed project has been at Sansamwenje, where they have built a COVID isolation facility.
Previously, when we come to the hospital when I'm sick, we may find that there are many patients in the clinic. Due to small bed space, we used to sleep in the ground. But for this building, there are many bed space. So when I come to the hospital, maybe I'm very sick, I will have a place to sleep nicely, and that will help me to get well better.
We also train government officials at district level of what the model is about. So the relationship with World Vision, the community, as well as the government, is that everyone, first of all, should understand what CVA is about, so that everyone is at the same page. Once government understands that the model really is something that focuses on issues that communities face, they are able to be receptive, such that when communities engage decision makers in a dialogue where they request for services to improve, they definitely understand that this is not an issue where they are being confronted, but an issue of wanting to have services improved.
As government, we are always open to work with partners to bring development to our communities, because this partnership is making us achieve our development goals. For we know to say that children are going to be responsible leaders of tomorrow, we need to invest in them today by providing a conducive environment for them to thrive and enjoy their livelihood.
And also this has enabled us as World Vision, our work to be easier, because these communities are now able to stand on their own and engage the partners, engage the stakeholders, engage the service providers to ensure that they are accountable of the services. The citizens have the right to demand for the services, quality service delivery.
As a child, I'm thankful to World Vision for empowering our parents in the constructing of this building.
Ichine chine ba World Vision bali bomba pakutusambilisha ifya CVA. Pantu tule bombela pamo ito tuamono obwafya twalanshanya twaishiba noko tufuiro kutwala obwafya bwesu.
Mkwayinga ba CVA ba Sansamwenje ifwe tuletasha sana mkwayi ba World Vision pakuleta ayamasambilo panti futa twaishibe twalishiba nomba so tulekabilo kwe bati tutwalilile nangu ba World Vision bengaya uyu mulimo ukaba mu minwe Yesu pantu twaishiba obukankala n'obusuma n'okutuleya.
At the end of the day, CVA is a sustainability model that World Vision uses, because as you know, after years of operation, World Vision always transitions. We go to areas where we still see challenges, where we see the most vulnerable people. So once that happens, the expectation is that communities should continue with the gains that have been achieved. And one way of ensuring that these gains are not lost is to continue engaging decision makers to improve services. So just as a way of trying to enhance sustainability, the model is providing an opportunity for communities to continue to engage, to continue seeking services that improve their well-being, and therefore communities will continue to live a good life.